Burnout is usually a sign that there's a poor fit between what the workplace demands and what the worker feels able to provide. And so it's less about the worker changing, it's often about the workplace having to change. And so one of the most important things is to feel able to speak up in your workplace, to feel able to speak to a manager, able to speak to colleagues and peers and say, this is what I'm experiencing. And usually what people experience that goes with this is a reduction in the quality of their work. So people become conscious that they're more likely to be making mistakes, perhaps to being harsh or rough in their care of patients, to caring less about the health outcome, to feel less able to commit to helping someone recover and get well. And this, of course, is a very big problem if a workplace is responsible for dependent people, people who are older, people who are very sick with COVID, or people who are in hospital for other reasons that really need them to be cared for with the usual kindness and consideration, technical skill that we know enables people to get well.
Yeah, because as you say, if it's the workplace that needs to change, that's very hard in a large hospital or in an aged care home.
Look, it is hard, and I think it places an extra responsibility on managers who are directly responsible and senior people within these organisations to do all they can to make it clear to workers that their efforts are valued. So all sorts of things are being done, but they're not necessarily available to all. Some of the things I've heard about is organisations that have made sure they've provided meals for people who are working very long shifts, who've really been considerate of their need for periods of relief for particular events or special consideration of time off. But most importantly, of making sure people are very well informed about all the decisions that are being made and that there's frequent public expressions of appreciation for the efforts that they're contributing to the common good.
How do you recognise if you might have burnout?
There are three signs that of experiencing burnout. One, as you've just alluded to, is a sense of profound exhaustion and fatigue that is not relieved by normal days off or weekends. The second is a sense of cynicism, as though the work you're doing is not of value. And the last is a sense of being devalued by your workplace, so that all your efforts and endeavours are not recognised or valued. And it's these three taken together that are an indicator of burnout.
Is this particularly acute in healthcare in Australia as we enter the third year of the pandemic? We know in Victoria a Code Brown has been issued which cancels the leave of healthcare workers.
Look, I think it certainly is. It's been documented, and I think as the latest wave, the Omicron wave, continues and there are these extra demands placed on healthcare workers, that really prevent them getting the periods of rest and recovery that are needed, that this will become more widespread. We know that it's experienced most by people who have the least agency in organisations, so people who are perhaps lower in the occupational hierarchy, who feel they've got much less say about where they work, what they do, which shifts they're assigned, and that it's probably less common among people who have some agency, organisational responsibility at more senior levels in an organisation. So we know that nurses, allied health workers, other healthcare assistants, aged care workers are particularly vulnerable to this phenomenon.
And on an individual level, I guess in Australia we have a cultural inclination to just keep going and to suck it up, to toughen up. Could that do more harm than good?
Look, I think if you notice yourself becoming irritable at work or if you really feel that it's very hard to think my work is something I value, my work is something I feel I'm good at and I have a contribution to make. So if that is that greater sense of cynicism, as though this is a pointless activity, then I think it's very important to be alert that this can be associated with a reduced quality of work, and that it is something that you need to speak to senior managers about what can be done to make your workplace one where you feel engaged and valued again. And that's hard at the moment. People feel that they don't have very much opportunity to do that because there's such an urgency of providing a lot of care to a lot of people, some of whom are very sick.